Terminologies used in anatomy. Definition of various terms used in anatomy. The anatomical terminology of the body can be studied under three groups: directional terms, sectional planes, planes of the body, and body cavities. Directional terms. Directional terminologies are used to locate one body structure with respect to other. Anterior, ventral direction towards front of the body. Anterior or ventral end. This includes the body parts present on the front side, like chest, nipples, abdomen, and external genitalia. Posterior, dorsal direction towards back of the body. Posterior or dorsal end. This includes the body parts present on the back side, vertebral column, also known as the backbone, shoulder blades, and buttocks. Superior, cranial towards the head or upper, highest-most point of the body proper. Example: head, neck. Superior, upper, cranial, end. The end of the head lies in the uppermost position, therefore it is known as the superior end. Inferior, caudal away from head or lower, lowest most point of the body proper. Example: feet. Inferior, lower, end. This part starts from the extremity of the main body or the trunk along the legs in the downward direction or ground. Proximal end, starting end of the joint or attachments. Proximal. It describes a body part that is closer to a point of attachment or closer to the trunk of the body than another part. For example, the elbow is proximal ho the wrist. Distal end, ending end of the joint or attachments and most distant region of proximal end. Distal. This position is the opposite of proximal. It means that a particular body part is farther from the point of attachment. For example, the fingers are distal to the wrist. Supine position. In this position the face is towards the upper side, roof, while the back faces downwards. Prone position. In this position the face focuses downwards or towards the ground. Medial position. It is an imaginary line passing through the longitudinal axis of the body, dividing it into two equal halves from the middle, starting from front to the back. Lateral position. It is that anatomical position of the body in which it is divided into two fragments, though the midline and the body structures remain away. Superficial. This position means situated near the surface. Peripheral. This position means outward or far away the surface. Symmetry-related terms used in anatomy. Asymmetrical, when the body parts not divided into equal half by cutting any plane. Radial symmetry, when the body parts divided into two equal half by cutting any radial plane. Bilateral symmetry, when the body parts divided into two equal half by cutting any one radial plane, otherwise not. Abdominal quadrants and including organs in anatomy. Right upper quadrants, RUQ, gallbladder, major parts of liver, minor parts of stomach, small intestine, parts of pancreas. Left upper quadrants, LUQ, tip of liver, spleen, major parts of stomach, parts of pancreas. Right lower quadrants, RLQ, ascending colon, cecum, appendix, right ovary, small intestine, uterus. Left lower quadrants, LLQ, descending colon, sigmoid colon, left ovary, small intestine, urinary bladder, anus. Abdominal region and including organs in anatomy. Right hypochondriac region, some part of liver, right kidney, gallbladder, parts of large, small intestine. Epigastric region, major parts of liver, stomach, adrenal gland, some parts of pancreas, spleen, duodenum. Left hypochondriac region, liver tips, stomach, spleen, pancreas, some part of left kidney, large, small intestine. Right lumbar region, gallbladder, ascending colon, small intestine, right kidney. Umbilical region, transverse colon, small intestine, duodenum, umbilicus, navel. Left lumbar region, descending colon, left kidney. Right iliac region, appendix, cecum, starting of ascending colon. Hypogastric region, urinary bladder, sigmoid colon, reproductive organs. Left iliac region, descending colon. Different positions in anatomy. Anatomical position, the body is erect, the head facing forwards, arms by the side and palms of the hand facing forward is called anatomical position. Supine position, when a person laying on her back, arms by the side, palm facing upwards and feet put together, is known as supine position. Prone position, when a person laying on her face and chest, arms by the side, palm facing upwards and feet put together, is known as prone position. Lithotomy position, when a person laying on her back and legs are temporarily supported by stripe, is known as lithotomy. These position mostly used in delivering of baby. Planes of the body. Sagittal. In this plane, an imaginary line slicing the body, from head to toes, into two halves with erratic proportion is drawn, from top to the down. Horizontal. This plane is parallel to the ground and passes through the body at the 90-degree angle to both coronal and medial plane. Coronal. This plane divided the body into anterior and posterior portion, by passing through the body at the right angle to the medial system. Anterior means the front portion and posterior means the back portion. Lithotomy position. In this position the individual is lying on the back with thighs fully stretched and knees directing towards the roof. Different plane in anatomy. Mid-sagittal plane. This plane divide our body in left and right parts. Coronal plane divide our body into front and back. Transverse plane. It is a horizontal imaginary plane which divide our body superior and inferior parts. 3. Body cavities. Cavities are the spaces of the body, containing internal organ. The two main cavities of the body are dorsal cavity and ventral cavity. Ventral cavity is the largest cavity which is further subdivided into the thoracic and abdominopelvic cavity. Both these cavities are separated by dome-shaped respiratory muscles called diaphragm. The different types of cavity. Thoracic cavity. This cavity is present ventrally on the upper side of the body. It also known as the chest cavity. This cavity contain the trachea, lungs, heart, large blood vessels, etc. Pelvic cavity. This is a body cavity that is bounded by the pelvic bones of the pelvis. This cavity contain urogenital system as well as the rectum. Abdominal cavity. This cavity is laterally attached to the body wall posteriorly by the pelvic cavity, anteriorly by the diaphragm. This cavity contain maximum part of the gastrointestinal tract, kidneys, etc. Dorsal cavity. This is the smallest cavity. In this the organs are situated more posteriorly within the body. This dorsal cavity is subdivided into two parts. 1. The first part include cranial cavity, upper portion which houses the brain. 2. The second part includes spinal cavity, lower portion which houses the spinal cord. Different positions.